Suboxone is a combination of buprenorphine and naloxone, which helps treat people who have been addicted to opioid drugs. People sometimes are prescribed opioid medications like morphine, Norco, hydrocodone to help manage pain at some point in their life. And maybe they have a hard time getting off the medications, or maybe their doctor doesn't prescribe as much as the patients feel that they need to take away their pain. And somewhere along the line, patients can get addicted to it. And so if they get addicted to it, they may buy it off the streets. They may try to use it in other forms like heroin or injectable forms. People can overdose from medications like fentanyl or heroin. And so Suboxone is an alternative that one can take where it's less likely that people develop this addictive nature to it, and it's less likely that people can overdose on it. So in other words, Suboxone is a good option for people who have a difficult time stopping pain medications. Buprenorphine has different effects on different opioid receptors. For some opioid receptors, like the delta receptor, it activates it. For other receptors, like the mu receptor, it partially activates it. And for kappa receptor, it's going to block that. Suboxone also has a naloxone effect, and naloxone basically blocks various opioid receptors in the body. These receptors in the body help moderate feeling of euphoria, help moderate pain. It helps alter some of the brain signals that are occurring in the brain. Some people also report some pain relief from Suboxone, but again, one of the major purposes of this medication, they're less likely to be able to die from overdosing on this medication than if they overdosed on opioids or fentanyl or something like that. Side effects of this medication can be similar to side effects that people on pain medications get, such as sedation, feeling nauseous, maybe vomiting, constipated, dizziness, headaches, sweating. The liver enzymes will transform buprenorphine into its active metabolite. And so it is important that the liver is functioning properly in order to take this medication. If the medication is not effective for people, it could be due to this ability for it to transform from buprenorphine to its active metabolite or active medication form. The dosing for this medication can get quite complicated, but I tried to simplify it. Basically, people who start this medication, it's okay to be in some opioid withdrawal. You shouldn't really take it while on opioids because it's kind of going to counteract the effects. And so you can start up to 8 milligrams a day of Suboxone on day one of going through the opioid withdrawal. And you can break this down into like a 4 milligrams taken twice a day. And then by day two, you go up to 16 milligrams a day, and usually I prescribe an 8 milligram tablet that you can take at the same time, or you can split it up throughout the day. The maximum dose typically is 24 milligrams of Suboxone a day, but it hasn't shown to be really that much more effective than 16 milligrams, so I don't typically recommend going higher than 16 milligrams a day. This medication used to require a special license and a special certificate training to dispense, but more recently it hasn't been as strictly monitored, and almost any prescriber can prescribe this medication. Typically, one can take it for 12 to 18 months, and then at some point, they should look to taper off of the medication. But Suboxone is a great choice for someone who has a history of addiction to opioids or are on opioids and have struggling to get off of them. This could be a good option.